Hi, I'm Dr. David Goldblum. I'm a psychiatrist, and I'm here at CAMH, also known as the Centre for Addiction and Mental Health, which is Canada's largest mental health and substance use teaching hospital. In this series, we're exploring the top mental health questions on the internet. So make sure to subscribe to our channel and turn on the notification bell to stay informed. In this video, we'll talk about the signs, symptoms, and characteristics of attention deficit hyperactivity disorder, or ADHD, and provide some helpful tips for how to best support young people with ADHD in a classroom, workplace, or community. ADHD is an ongoing pattern of inattention and/or hyperactivity and impulsivity that interferes with functioning or development. It affects approximately 5 to 9% of children and 3 to 5% of adults. It's one of the most common disorders among young people and is 3 to 4 times more common in boys than girls. Most young people show some of the symptoms of ADHD at different times, including being inattentive, distractible, impulsive, or highly active. A diagnosis of ADHD may result when those symptoms occur more frequently and are more severe than is considered average among young people of the same age or developmental level, and that the symptoms are a barrier to these people meeting their potential and functioning well in a variety of settings: school, work, and home. If these behaviors persist over time and have this kind of negative impact, treatment may be recommended. The symptoms of ADHD fall into 3 main groups of behavior: inattentiveness, hyperactivity, and impulsivity. Most young people display many of these behaviors at different times. We all do, to a certain extent. It only becomes a problem when those behaviors start to negatively impact functioning or limit potential. Like every other health problem, a diagnosis of ADHD should be made only after a careful history is taken, with input from family and/or teachers who know these individuals longer and better than most clinicians. Validated rating scales for ADHD can help support a diagnosis. A number of treatment interventions are effective in helping young people with ADHD. The important thing to know about ADHD is that it is fairly easy to treat. While treatment for ADHD should never be just medication, ADHD medication has been proven to be safe and effective. ADHD medication does not cure ADHD, but decreases many of the ADHD symptoms. Cognitive behavioral therapy, or CBT, is a non-medication treatment for ADHD that can help build self-esteem, reduce negative thoughts, and improve problem-solving skills. CBT can also help people learn self-control and improve their social skills. Other healthy habits that can improve brain functioning for those with ADHD include regular exercise and good sleep habits. Provide an environment that is as predictable in routine as possible. Give lots of notice and clear instructions of any changes in their routine in advance. Provide a calm, quiet atmosphere without too many visual distractions. Begin conversations by addressing people directly, using eye contact, and wait until they are paying attention before speaking. Give instructions one step at a time, rather than issuing multiple steps at once. Have them repeat the instructions back to you. Provide clear and simple rules. Consider posting the rules somewhere visible. Find out what people are good at and incorporate this into activities. Ask people what they think will help them succeed in the workplace. Educators can design programs for young people with ADHD to encourage success rather than failure, and to address any coexisting learning disabilities that students might have, such as difficulties with reading. A child who is diagnosed with ADHD and treated appropriately can have a productive and successful life. Some suggestions for how to structure class time include: provide shorter work periods, break down assignments into small manageable units, seat the student at the front of the class and away from distractions, give extra time for tests, and hand out one sheet of a multi-page test at a time. Communicate each homework assignment a number of times, both verbally and in writing. Have the students use a daily planner to keep a record of what they've done and what they still need to do. Encourage students to use aids to deal with symptoms, such as earplugs to avoid distractions, or a stress ball to play with instead of fidgeting. For younger children, assign simple errands so that they can move around and feel useful. In summary, ADHD is one of the most common disorders among young people and is characterized by an ongoing pattern of inattention and/or hyperactivity and impulsivity that interferes with functioning and development. There are lots of ways young people with ADHD can be supported in all areas of their lives. I'm Dr. David Goldblum. Thanks for watching. Did you like this video? Subscribe to our channel for more evidence-based insights on mental health and substance use.